Yesterday's Maricopa County vote on Prop 409 called for a nearly $900 million bond for Valleywise Health to expand its hospital and its resources. At last check, the proposition was passing, just barely though, 10,900 vote margin. So it's passing, and we'll talk to Steve Purvis. Joining us now, Steve Purvis, President and CEO of Valleywise Health. What do you think of that margin there? You think you're out of water yet, or what?
Well, it's a close vote, but we feel very confident in terms of where things stand now. We'll find out more, this evening and tomorrow.
Yeah. Why do you think that voters so far, it's a small margin, but they are voting for this proposition? Why do you think they went for it?
Well, I think, the more you hear about our mission, I think the more you support it. Awareness is a factor, in a large county like this. And so we were very pleased, with the turnout. I think it was about 22% of the population for a bond measure, like this. So we feel very comfortable that, once people, know what we do, where we do it, how we do it, that there's quite a bit of support for it.
If the margin holds, what does it mean to Valleywise Health?
Well, it means that we're going to be able to realize the next phase of our master facilities plan that's all based on community need, especially essential services like behavioral health care. We were achieving 2028, 2030 estimated volumes the day that we opened up our new medical center. And so this is the next iteration of us keeping up with the demand for services.
I see replacing an inpatient psychiatric hospital, construction of a, $220 million new facility, huh?
Yes, sir. And we have an old facility on our campus that's not in keeping with the standards of care, and so we'll be able to replace that behavioral health facility with about a 200-bed facility that'll add about 100 new beds for us to help with that demand, in the county.
Closer to the main hospital as well, right?
Yes, it's right on our campus, which has a number of advantages in terms of being close to our emergency services, et cetera.
$500 million for outpatient health facilities. Talk to us about that.
So we have outdated facilities in our community health centers network that we need to finish building out. One of them is in South Central Phoenix that houses our family medicine residency program that is by any stretch outdated. And so this will be a facility that really brings a lot of comfort and dignity to patients, and also promotes our clinical learning environment.
So we're talking neighborhood clinics here?
Yes, community health centers that's there for vulnerable populations.
And I also see that an outpatient specialty care clinic is in the works if that passes. Talk to us about that.
Correct. So that's the outpatient facility that we have on our main campus that sees all kinds of illnesses and maladies and for specialty care. That facility doesn't work anymore with the volume of patients that we're seeing. And so after we clear off our campus, there'll be space to locate a new comprehensive health center.
And an outpatient surgery center.
Yes, we want to make sure that we keep up with the demand for surgical services that we have. And there are many cases that's really not that appropriate to be in the inpatient setting. And this will bring more convenience and a lot more efficient care to patients.
And with all of this, the money would also help to expand the main facility.
Yes, as I said, we were achieving just record demand in our new hospital the day we opened. And so our emergency department volume and the backup of patients that we're seeing now requires that we add to some observation beds that offloads those emergency patients to other more appropriate places. And we also have a 10th floor on the new hospital that is shelled in that we plan to build out to accommodate the inpatient demand that we're seeing.
Interesting. All right. I know people probably watching right now and they're going, okay, and we kind of mentioned this on the air before. It's like $29 per year in residential tax, property tax increases, maybe a couple $100 here for an average commercial property owner. And they're saying to themselves, wait a minute, why am I paying for a hospital?
Right. So we've been here for about 150 years, and we've always been a public safety net system of care and a public teaching hospital. We serve a very underserved population, as you can imagine, many of which are uninsured, and a high percentage of them are on Medicaid. So every vibrant community in America has a strong public hospital system to fulfill a mission. And so we place facilities in areas that need care so that we can provide access to everybody without regard to their ability to pay.
And I was going to say, that's the big part of the mission, correct? I mean, that separates what you do from other hospitals that people might be more familiar with.
We're the only public healthcare system in Maricopa County, and we have a very specific mission to fulfill. And so we've never, ever done things by ourselves here in Maricopa County or, frankly, around the state. We've always relied on the generosity of the public to do this and the understanding, of our mission. And we're so very pleased that the voters stepped up to the plate and came out to support us.
It's still a relatively small margin, though, here. And I know that critics and those who are against the proposition say this is subsidizing funding care for undocumented people. That was a major tone of that particular argument. How do you respond? How do you respond to that? And do you think people responded correctly?
Well, there's a lot of confusion around that issue. Remind you, back during the Reagan administration, a federal law was passed, the Emergency Medical Treatment and Labor Act, or EMTALA, and that requires every single hospital, if you have an emergency department, to treat anybody, regardless of who they are, and to medically stabilize these folks and treat them if you're capable. That's a requirement for all hospitals. So it's not. And by the way, undocumented individuals don't qualify for Medicaid, so we're not paying or subsidizing their care, but we're required. It's an unfunded mandate that we're required to see anybody that steps foot inside our doors.
Last question here. Let's say it passes. How soon do shovels start moving dirt?
We'll start, assuming it passes, we'll start the planning process right away. That's going to take a while. And so, I would say it's going to take a couple of years, before we're really going, with the bid process and the selection of the team, et cetera, and get going with construction.
So it's a long-term process here.
Yes, sir.
All right, Steve Purvis, Valleywise President and CEO. Thank you so much for joining us. We certainly
Thanks for having me.
appreciate it. You bet.